Today, every day, small cap investors visit Agoracom knowing this is the day to discover the world's next great company, to have their dreams come true. That's why I take to the open road, to find them, to tell their stories, to engage them, to bring them to life, because they want to connect with you from your office, your phone, your home, anywhere. Agoracom, find your dream.
Welcome to CEO Interviews, a production of Agoracom, in which we take the time to speak with small cap executives and their teams about what's going on at their companies. With us today, and happy to have for the first time, Junaid Malik. He's software engineer at Star Navigation Systems. The company trades on the CSE under the stock symbol SNA, and for our friends in the US on the OTCQB under SNAVS. Now, for those of you who are new to the story, and that's definitely going to be some of you, but we've got a lot of Star Navigation shareholders watching this as well. Star Navigation has developed real-time worldwide tracking and monitoring systems for commercial airlines, regional aircraft care operators, and business aircraft operators. Now, the primary role for the software is to create significantly improved efficiencies with tremendous ROI in the software, but in addition to that, to prevent or at least help recover in situations like the infamous MH370, the Malaysian Airlines flight that went missing and is still missing today, 4 years ago off the Indian Ocean, presumably. In addition, the company has now moved into flat panel and LCD displays, as well as control units for aerospace and defense operators. So their clients there include the likes of Lockheed Martin, CAE, and Northrop Grumman, Italy. So they're doing fantastic things in the aerospace industry. And now what we're here to talk about is their Medevac, which is a real-time telemedicine for emergency medical evacuation by air transportation. Here to talk about that is Junaid. Welcome to the show.
Hi, George. Pleased to be here.
Hey, it seems like your capability at Star Navigation either save lives or help airlines with these kind of critical situations just seems to be expanding again with Medevac. You haven't made any official announcements on this yet, but you've got the information on your website. We saw it. We want to talk to you about that. Before we get into it, in layman's terms, explain what Medevac is, how it works.
Well, George, Star specializes in the acquisition of aircraft data, and we provide operators with the ability to monitor aircrafts. We're doing the same idea here, but we're doing it with a patient connected to a biomedical device, spitting out health information, and a doctor or a hospital on the ground monitoring that patient. Same idea Star has been doing with an aircraft. We're doing it now with the real patient on board an aircraft, being medically evacuated, being brought to a hospital, and a doctor at the same time on the ground monitoring vitals and other health and human information. That's what we're doing with Medevac.
Safe to say you're kind of piggybacking on the technology Star has in place with some tweaks and upgrades and things like that?
It only makes sense to do that. I mean, we've been doing it so well with one application. Why not easily extend it to another?
Now, how long have you been working on Medevac? Is this a relatively new technology at Star because you've had your hands full doing some other real incredible stuff? Or have you been working on this for a while and now just bringing it out?
The idea of Medevac has been there for quite some time. It's just that now we have the technology to realize and bring that idea to reality. It's always been there, but now the technology that's coming out is allowing us to actually implement and get ready for the first commercial application of Medevac. Idea has always been there. The technology is coming out now for us to develop it.
All right, that sounds like you're pretty advanced. What stage of development would you say you're in? Are you ready for commercialization, or are you just about there?
We have a proof of concept. We have a simulated biomedical device, and in the near future, we'll be using a real-life biomedical device to interface with our SSU, which is our Star Server unit, and we'll be using that to monitor a patient and transmit information via SATCOM.
So let's talk about that simulation. So you've run simulated tests already, because I would think if you're running simulated tests, then there probably wouldn't be that big of a difference when you actually put the technology into a helicopter or something, because it's running off the same technology. How much success have you had with that? on the simulation
We've
side?
been very successful. We've already rolled out a demonstration, a video, which we're showing to selected parties, and you're one of them. We've worked through the simulation. The next step is to incorporate a real biomedical device and have it interface with our SSU so that we can actually use it for a real commercial application with a real patient on a real aircraft.
And by the way, for everyone at home, the video that he's referring to, we're going to play at the end for everyone's benefit. It's a fantastic video, 2.5 minutes. So we just want to have this great discussion here first. Question on patent side, because this space, patented technology is very, very important. There's obviously a very competitive space. Have you patented Medevac?
STAR owns the patent rights to a project like Medevac. The patent description includes the ability for our SSU to interface with the medical device, acquire information, and transmit that information to the ground. The patent rights protect a project like Medevac, and STAR owns those.
Okay, that's incredibly impressive. So let's go to the market side of this. I have to imagine, look, I live in Ontario and I see the orange helicopters, unfortunately, flying overhead, especially when they're coming in from cottage country. You'll see them, once every few days. So obviously there's a demand for these kind of things, has to be all over the world. Have you guys, obviously you've gotten to the States, so you've probably determined how big this market might be.
Well, you know what? I'm not going to spit out any of the numbers. I wouldn't know them off the top of my head, but I can tell you that the healthcare industry and the medical evacuation industry is valued at billions. Especially by the year end of 2020, it will be valued at billions. But that's not the reason we're getting into it. The intent is noble. It's to provide a service. It's to help patients. And if it turns out to be a lucrative idea, then that's great. But the intent is not to make money, but it's a noble idea. Same idea that we apply to our STAR ADS with monitoring aircraft and trying to detect a problem before it happens. This is the same idea. We're providing doctors an extra hand, aiding doctors to be able to look into the patient's information before they arrive at the hospital. But the market will welcome this with open arms. I promise you that.
And you talk about doctors, and I got a quote, because I did some research, obviously Medevac, and I got a quote from your page. If I can indulge me and just read this for a second, I'm going to paraphrase, but according to professors George Kadam and from ETS and Dr. Philippe Juvet, real-time transmission between aircraft and hospitals will significantly help to improve the quality of care while providing access to vital signs, imaging, and other critical information about the patient. It'll help save many lives by helping doctors provide initial diagnosis as well as preparing them for arrival at the hospital. So this is pretty fantastic technology that, you're right, is noble, because let's face it, we do know that a lot of countries have Medevac. We just talked about Orange in Ontario, but are there other applications, other verticals here? Like, do you go military? Do you go commercial? Because sometimes we hear that people are flown on private jets in order to get to medical aid. Or do we even go to regular commercial where somebody might be sick on the plane and instead of forcing it to land? So where are you guys looking to go as far as your verticals?
We're looking to run wild with this thing. It's not only it's not only commercial, but when you look at military, there's a lot of interest from those parties to develop something like this. And even going further, the next generations of Medevac won't only include biomedical devices; they'll include augmented reality. We'll have cameras zooming in on patients. We literally intend to have a holographic doctor present on an aircraft, assisting crew members in diagnosing and helping a patient. That is the vision here. We will have two-way messaging. We'll have cameras overlaid. We will have doctors literally looking into the patient. And that is the vision. That is where we want Medevac to go in the next 5 years, 10 years, and so on and so forth. The applications are tremendous: military, commercial, and many more.
And I got to admit, that makes tremendous sense, because I've been watching, I watch CNBC and the business channels, and I've been watching Cisco run these ads, how they want to set up, virtual hospital rooms in rural stations all over the U.S. because they they're 2 hours away from primary medical care. Now that's on the ground, right? So it just makes sense that you're extending this to the air. And I wish I'd thought about this sooner, but you guys are obviously on top of it. But man, you're on the same trajectory. Cisco's advertising all over CNBC as we speak.
Exactly. And this is Star's answer, or rather response to the deficiency in the medical transport industry or the medical evacuation industry. It's pretty deficient considering a patient is being monitored by members, the crew members rather, and a doctor has to sit patiently while the patient arrives. But what if the doctor can actually see that patient, monitor that patient before they land? I mean,
I would even think for non-emergency situations, correct me if I'm wrong, but you've got commercial airline now, Air Canada. I'm suffering from a little bit of chest pain. I'm not sure what it is. And suddenly the plane's got to divert and land, which costs a lot of money, but you got to play it safe. A lot of inconvenience to other people, but again, you got to play it safe. Could we get to a situation where, medevac is being used to quickly diagnose George with a doctor on the ground who's going to determine, in fact, he's not having a heart attack, he's just having some anxiety attack because he doesn't like flying and therefore is safe to continue? Is that also an ROI benefit potentially for commercial airlines?
Medevac plans on healing George right up. We plan on fixing you right then and there, and it's the same idea. I said before, Star ADS wants to proactively monitor aircrafts and correct the problem before it happens. The vision here is to detect the error, or rather the anomaly inside a patient, and have the doctor know that information beforehand. It's really that simple, that we are actually extending this kind of an idea to an actual human.
Junaid, I got to tell you what's really blasting through in this interview, because we've never done an interview like this, is your confidence in this. That's very important because look, I've told the Agoracom audiences before, you've got to read the body language and just listen to the confidence in the person speaking, because you're not umming and ahhing, you're not kind of searching for an answer. You're hammering it, which tells me you guys have really put a lot of thought, a little time into this, and that's very encouraging as a person, because you said there's a noble cause here, but at the same time as a shareholder. I want to ask you one more question, and if I'm premature, let me know.
If I may interject.
Sure, sure.
So the video that you are about to play at the end, once we actually developed that and we seen it working for the first time, the hair on the back of my neck stood up. And that's where the confidence comes from. It's not because we're looking to sell something, it's because we know we have something golden.
Love
That's it.
Yeah, I love that.
Yeah.
It's coming through loud and clear. So I got to tell you, I think I'm almost more excited about this particular application than other Star applications, which are very exciting on their own. But
they're all exciting. I promise you that. They are all exciting.
Yeah, but this one sounds fantastic. So one last question before we go to video, and tell me if I'm premature, but I got to ask because I got the feeling people at home are probably thinking about it as well. Have you guys had any expressions of interest from potential customers? Have you had any discussions with potential customers, letting them know about Medevac?
Well, we wouldn't be working on this for free. So we have a lot of interest, and that's all I could say about that.
All right, I got to tell you, that's more of an answer than I thought I was going to get. I thought you were going to tell me, George, we can't talk about that right now, but if you've already got a lot of interest, that's great. And look, if you just had to use linear logic, you guys have been in this space for a long time. You obviously have great people on your board who are in the aerospace industry. You've got clients like Lockheed Martin, CAE, Northrop Grumman, Italy, that you're talking to on a regular basis with your hardware on the hardware side. So to me, it would make sense. What's that?
More customers to come.
All right, love the confidence. Junaid, we're gonna end it there before we cut the video, but thanks for joining us today. Any last comments before we cut the video for everyone to watch this 2.5-minute demonstration?
Thank you, George. And before I leave, thank you to all the investors, because without them and without their support, projects like this would not come to reality. So thank you very much to the investors. Thank you for your support so far, and thank you for your continued support. We're very grateful.
Well, I think it goes without saying that you probably have people at home nodding right now and saying thank you guys, because you're doing great things with their investment, and obviously things like Medevac. You've been watching Junaid Malik. He's software engineer at Star Navigation Systems. The company trades on the CSE and the stock symbol SNA, and for our friends in the United States, SNAVF, which is on the OTCQB. Normally, this would be the end of our videos, of our interviews, but it's not. We're going to cut the video. We'd like all of you to watch it naturally. It's very exciting stuff, and you can hear and see the excitement in Junaid. And then don't forget, get over to Agoracom. You got your CEO verified discussion forum. It's moderated, it's clean, it's constructive. Ask questions. You can talk to Junaid, you can talk to the company, and get your answers, because this is what we're all here to do, is communicate together and watch STAR really expand into this next phase. Thanks for joining us. Watch the video. See you in Agoracom.
Hello and welcome to Medevac, a brief introduction and demonstration brought to you by Star Navigation Systems Group. The Medevac application entails connecting a biomedical device to the SSU using device adapters. The SSU then acquires biomedical data and transmits the data using embedded SATCOM and cellular modems. The modes of transmission can then either be based off a satellite network or a GSM network. For the ease of demonstration and proof of concept, we will be basing this demo off an internet transmission. Commercial applications of Medevac will be using either cellular or satellite modems. We begin the demo now by initiating the medical simulator to route data to our SSU. Once the SSU receives data, it will transmit the data to our ground server and then to a website for graphical representation. As you see now, the graphs are being populated. There is a total of 6 displays on this web page. We continue to let the transmission flow in this manner. A few words should be said about the future of Medevac. There is great interest from external parties and customers for us to fully develop this application. STAR specializes in the acquisition and transmission of aircraft data, and we will be the first in the industry to transmit biomedical data from a patient on board an aircraft. Most importantly, STAR has patent rights to a project such as Medevac. There is also a great push to include augmented reality in future generations of Medevac. Augmented reality will include video interfaces to better assist doctors and hospitals in monitoring patients on board aircrafts. You may be wondering how all this can be possible when satellite communication is the primary means of transmission for most aircrafts. With the launch of Iridium NEXT by the end of 2018, we can leverage faster speeds and higher bandwidth. Along with the release of newer satellites by Iridium, newer modems will be released which will provide many capabilities in regards to transmission. We have a project plan to complete the first generation of the Medevac application by the third quarter of 2018. Iridium NEXT will lay a solid foundation to help us bring these ideas to a reality. Thank you for tuning in.